Bismillahirrahmanirrahim. In the name of Allah, the most merciful and the most kind. Assalamu alaikum. My name is Sayyidina Aisha Hussain and I am doing BS Chemistry from the University of Management and Technology. Today, the topic of my presentation is acetylcysteine and it is submitted to Dr. Hammad Majeed. Let's have a look at the table of contents. The things we are going to present are what is acetylcysteine, history of acetylcysteine, manufacturing of acetylcysteine, importance of acetylcysteine in medicine, chemical structure of acetylcysteine, side effects of acetylcysteine, precautions, mechanism of action, dosing, uses of acetylcysteine, how to use acetylcysteine solution, inhalation solution, interaction with other medication, storage and its references. Now we are going to explain what is acetylcysteine. An antioxidant drug used to reduce the thickness of mucus and ease its removal. It is also used to reverse the toxicity of high doses of acetaminophen. Moving towards the history of acetylcysteine, how acetylcysteine appeared. Acetylcysteine, a compound derived from the amino acid cysteine, has a multifaceted history in medicine. Initially developed in the 1960s, it gained prominence for its mucolytic properties, aiding in the breakdown of mucus associated with respiratory conditions such as cystic fibrosis and COPD. Over time, acetylcysteine's role expanded, notably as an antidote for acetaminophen overdose, demonstrating its efficacy in emergency settings. Beyond its well-established uses, ongoing research explores the broader therapeutic potential of acetylcysteine across various medical domains. Additionally, acetylcysteine serves as a critical antidote for acetaminophen paracetamol overdose. Its mechanism of action involves replenishing cellular glutathione and promoting the removal of toxic metabolites. Ongoing research explores its potential applications beyond respiratory and overdose contexts, highlighting its versatility in various medical situations. Now I am going to explain the manufacturing of acetylcysteine. How acetylcysteine prepared. The manufacturing of acetylcysteine comprising the following steps. Number one, adjusting the pH value of the cysteine whether liquid to 9 to 12. Number two, adding acetic anhydride at 40 to 60 degrees Celsius within 20 to 60 minutes for acylation reaction. Number three, preserving heat to obtain an acylation liquid. Number four, neutralizing and crystallizing the acylation liquid to obtain a crude and acetylcysteine product, and recrystallizing the crude and acetylcysteine product to obtain the compound. Number five, according to the invention, the mother liquid obtained after cysteine is produced from cysteine hydrochloride is used as a raw material so that refined and acetylcysteine can be prepared and the profit is improved on the basis of reducing the production cost and relieving the environmental pressure, thereby improving the enterprise competitiveness. Now moving towards the importance of acetylcysteine in medicine. Acetylcysteine holds significant importance in medicine for several reasons. Number one, respiratory conditions. It is widely used as a mucolytic agent, help to break thin and break down mucus in the airways. This is particularly beneficial in respiratory conditions like chronic bronchitis, cystic fibrosis, and chronic obstructive pulmonary disease. Now I'm going to explain these terms. What is cystic fibrosis? It is a disorder that damages your lungs, digestive tract, and other organs. Chronic obstructive pulmonary disease. It is a common lung disease causing restricted airflow and breathing problems. Number two, antidote for acetaminophen overdose. Acetylcysteine is a crucial antidote for acetaminophen paracetamol overdose, a common cause of drug toxicity. It works by replenishing depleted glutathione levels, preventing liver damage and failure. Number three, bronchoscopy procedures. In medicine, acetylcysteine is sometimes used during bronchoscopy procedures to improve visibility by reducing mucus secretion. How it works during bronchoscopy procedures. During bronchoscopy procedures, acetylcysteine helps to thin and loosen mucus in the airways. This can make it easier to clear secretions and improve visualization during the procedure. Number four, potential antioxidant properties. Beyond its established uses, ongoing research suggests that acetylcysteine may have an antioxidant properties and could play a role in mitigating oxidative stress in various medical conditions. Number five, emerging therapeutic applications. Research is exploring the potential of acetylcysteine in diverse areas, including neurology, psychiatry, and cardiovascular medicine. Its ability to modulate glutamate levels in the brain, for example, has prompted investigations into its role in neurological disorder. Number six, versatility and safety. Acetylcysteine is generally well tolerated and has a wide range of applications, contributing to its versatility in medical settings. Its safety profile enhances its use in emergency situations. The compound's multifaceted properties make it a valuable tool in medical practice, addressing both acute and chronic conditions while continuing to be an essential component in emergency care. Here is the chemical structure of acetylcysteine. The molecular structure of acetylcysteine, also called N-acetylcysteine or NAC, is derived from the amino acid cysteine. Its chemical structure can be represented as follows. The chemical formula of acetylcysteine is C5H9NO3S. Here is the structural formula of acetylcysteine. In this structure, the C represents carbon, the H represents hydrogen, the N represents nitrogen, the O represents oxygen, and the S represents sulfur. The acetylcysteine molecule consists of a cysteine molecule with an additional acetyl group attached to the nitrogen atom. This modification influences its pharmacological properties and enhances its bioavailability. We are familiar with some of its side effects. Common side effects of acetylcysteine include number one, nausea and vomiting. Some individuals may experience nausea or vomiting, especially when taking higher doses of acetylcysteine. Number two, rash or skin reactions. Skin reactions such as rashes or itching can occur in response to acetylcysteine. Number three, foul odor. This medication has a characteristic sulfur smell, which may cause discomfort or unpleasant taste. Number four, stomach upset. Upset stomach or abdominal pain might occur as a side effect of acetylcysteine. Number five, allergic reactions. Though rare, allergic reactions such as swelling, itching, or difficulty breathing can occur. Seek medical attention if these symptoms occur. It is essential to inform healthcare providers of any allergies or pre-existing conditions before taking acetylcysteine. Serious side effects are uncommon, but immediate medical attention is necessary if any severe allergic reactions or adverse effects occur. Always follow prescribed dosages and usage instructions to minimize the risk of side effects. Now let's talk about the precautions. While acetylcysteine is generally considered safe, it's important to be aware of precautions and potential side effects. Here are some precautions to consider. Number one, allergies. Inform your healthcare provider of any known allergies, especially if you have a history of hypersensitivity to acetylcysteine or any related compounds. Number two, asthma. Individuals with asthma should use acetylcysteine with caution as it may cause bronchoconstriction in some cases. Close monitoring is recommended. Number three, peptic ulcers or GI bleeding. Use acetylcysteine with caution in individuals with a history of peptic ulcers or gastrointestinal bleeding as it may exacerbate these conditions. What is peptic ulcer? Peptic ulcer is an open sore in the lining of stomach or intestine, and gastrointestinal bleeding is any type of bleeding that starts in your gastrointestinal tract. Number four, pregnancy and breastfeeding. Consult with a healthcare professional before using acetylcysteine during pregnancy or while breastfeeding. The potential benefits should be weighed against possible risks. Number five, medication interactions. Inform your doctor about all medications, supplements, or herbal products you are taking, as acetylcysteine may interact with other certain drugs. Number six, renal impairment. Adjustments in dosage may be necessary for individuals with renal impairment. Consult your healthcare provider for personalized recommendations. Number seven, full odor sensitivity. Some individuals may find the odor of acetylcysteine unpleasant. If this is a concern, discuss alternatives or strategies with your healthcare provider. Now I'm going to explain the mechanism of action of acetylcysteine with the help of this diagram. Acetylcysteine works at the molecular level by providing a source of cysteine, a precursor to glutathione. What is glutathione? Glutathione is an important antioxidant in the body. Acetylcysteine is thought to replenish glutathione levels, which helps neutralize reactive oxygen species and protect cells from oxidative stress. Additionally, acetylcysteine can break disulfide bonds with mucus, making it less viscous and aiding in the treatment of conditions involving thickened mucus such as respiratory disorders. Let's talk about the dosage of acetylcysteine. And acetylcysteine is an FDA approved prescription drug. FDA stands for Food and Drug Administration. It can be taken in various ways, including by mouth, by IV. IV stands for intravenous, and by inhalation. It is the most commonly taken by mouth in doses of 600 to 1200 mg daily. Speak with a healthcare provider to find out what type of product and dose might be best for a specific condition. And acetylcysteine is also available in many dietary supplements, but according to the FDA, using an acetylcysteine in supplements is illegal because it is an approved drug. Supplement products should not be used in place of prescription products. Now we will discuss the uses of acetylcysteine, that how acetylcysteine is used. When inhaled, number one, when inhaled by mouth, acetylcysteine is used to help thin and loosen mucus in the airways due to certain lung diseases such as emphysema, bronchitis, cystic fibrosis, pneumonia, which we will talk about in the video later. Next, this effect helps you to clear the mucus from your lungs so that you can breathe easier. The next point is when taken by mouth, acetylcysteine is used to prevent liver damage from acetaminophen overdose. And acetylcysteine is a drug that is very useful in the detoxification of kidney. The next point is moreover, NAC is helpful in improving psychiatric conditions such as autism and depression. It is also helpful in improving the conditions such as behavioral disorders and bipolar disorders as well. It helps in regulating blood sugar level. Furthermore, it decreases the risk of heart damage. Also, it regulates glutamate, which eventually leads to the improvement of brain health. How to use the acetylcysteine solution? If you are using this medication to treat lung disease, inhale this medication by mouth as directed by your doctor. A healthcare professional will show you the proper way to use this medication. Learn all preparation and usage instructions. Next, you may notice a slight odor when you first breathe in the medication because it contains sulfur smell. This odor will quickly go away. If you are using a face mask to breathe in the medication, there may be some stickiness on your face after use. Wash your face with water to remove the stickiness. Next, do not mix acetylcysteine with other inhaled medications unless directed by the doctor or pharmacist. If you are taking this medication by mouth, take it as directed by your doctor. The solution is usually mixed with another liquid such as cola to decrease nausea and vomiting. During the medication within 1 hour or mixing, tell your doctor if you vomit within 1 hour after taking your medication. You may need to take another dose. The dosage is based on your medical condition and response to treat. For acetaminophen overdose, the dosage is also be based on your weight. Tell your doctor if your condition does not improve or if it worsens. Let's talk about the acetylcysteine inhalation solution. Acetylcysteine inhalation solution is used to help break up the thick, sticky mucus that form in the airways if you have certain diseases. These diseases include bronchitis, pneumonia, emphysema, asthma, cystic fibrosis, and tuberculosis. Let's talk about these diseases. What is bronchitis? Bronchitis is a condition that develops when the airways in the lungs, called bronchial tubes, become inflamed and cause coughing, often with mucus production. Pneumonia. Pneumonia is an infection that inflames the air sacs in one or both the lungs. And what is emphysema? Emphysema is a condition in which the lungs are damaged and lower, causing breathlessness. Asthma. Asthma is a chronic condition that affects airways in the lungs. Cystic fibrosis is a disorder that damages your lungs, digestive tract, and other organs. And tuberculosis is a serious illness that mainly affects the lungs. Tuberculosis is caused by a germs, and the germs that causes tuberculosis are a type of bacteria. Moving towards its interaction with other medications. Acetylcysteine inhalation solution may interact with other medications, vitamins, or herbs you may be taking. An interaction is when a substance changes the way a drug works. This can be harmful or prevent the drug from working well. To help avoid interactions, your doctor should manage all of your medications carefully. Be sure to tell your doctor about all medications, vitamins or herbs you are taking. This medication may interfere with certain lab tests such as urine ketone test, possibly causing false test results. Make sure lab personnel and all your doctors know you use this drug. Now I'm going to explain its storage, how acetylcysteine should be stored. Store at room temperature away from light. After opening the vial, store in the refrigerator and use within 96 hours. The solution may change to a light purple color. This is normal and will not affect how the drug works. Do not store in the bathroom. Keep all medications away from the children and pets. Do not flush medications down the toilet or pour them into a drain unless instructed to do so. Properly discard this product when it is expired or no longer needed. Consult your pharmacist or local waste disposal company. Here's the links of references where the material has taken. Thank you so much. I hope you liked the video. Kindly subscribe the channel of Dr. Hammad Majeed.